the main feature of the program is culturally sensitive, customized, gender-focused prevention and intervention support for the immigrant families. That is the main feature of the program. And it is an intersectional approach to eradicate gender-based violence. So that is our main goal. Family conflict prevention program aims to increase accessibility and decrease barriers to community services for immigrant women and their families living in family conflict situations. Services are offered in first language. Currently, the counselors, they speak different languages, which are Arabic, Amharic, Bengali, French, Hindi, Mandarin, Punjabi, Pashto, Spanish, Tigrinya, and Urdu. We are also looking, we have some counselors in Farsi as well. Services include intake, assessment, crisis, and short-term counseling. Support groups are also offered, and those support groups are offered to men and boys as well. Even it is offered to secondary victims of abuse and violence. We definitely do individual counselings, couple counselings. We do support groups, workshops to educate the community. We offer advocacy, referral outreach, volunteer support, and follow-up. The program acts as a bridge between abused immigrant women, their families, and the community. Clients are connected to appropriate community supports and gain the skills and coping strategies to deal with conflict situations.
The initial outcomes that we look for is that all the immigrant women and their families, they learn about how to access the support. Then the community members also learn about the services available for immigrant women. So, and we accomplish this through outreach. Other initial outcome for the prevention support is that the immigrants learn about their individual rights in Canada. The other outcome is that the community learns about the factors that trigger the family conflict among immigrant families, like the stress factors related to immigration itself. The counseling support outcomes are that, the clients learn about their own issues and barriers, because sometimes they don't even realize that these are their true underlying issues. Then the clients learn about some of the coping strategies to address their grassroots needs. Then they learn about how to break away from the abusive situations. They have strategies and tools and skills and mechanisms to support their own children. Then we also have some initial outcomes that we have laid out for the partnerships and collaborations that we have. So the partners that we engage with learn benefits of taking a collaborative approach. Organizations learn ways to support immigrant women dealing with the family conflict in a very culturally sensitive manner. One of the tools that we have is the risk and protective factors assessment. So this helps counselors identify the areas of support that are required by the client, and they discuss the safety plans based on the risk factors that they have. The other important ingredient is also yet another tool, which is our CORS, we call it the client outcome rating scale. So that also again helps both the counselors and the clients determine the level of understanding of the issue that is being discussed during the counseling session, and what needs to be discussed in the future sessions. Then they assess what are the needs to be done in an emergency situation, or how much independently the clients can access community resources that they have been sharing. So those enable the program to modify and customize the future workshop topics, support group topics, further customization of support groups based on the needs identified and the challenges presented by the individuals. The other piece is also engaging with multicultural communities, family members, and faith leaders to build their understanding and to help them, be aware of the domestic violence issues. They may not perceive it the way we are perceiving it, because we are going deep into finding all the nuances, the subtleties. They may not have the clinical insight. So we want to make sure that they have that in perspective as well, right? So, and then equipping all the staff with the settlement organizations to recognize the signs of abuse and high risk. And then also engaging not only just service providers like us, but the community stakeholders in the relevant consultations, subject matter expertise, and also joint initiatives. So that really helps us collectively make an impact. So some of the unique or the novel features that contribute to making this program a promising practice is our provision of services in the offsite location. Sometimes it's also due to the cultural sensitivity, due to the stigma. Sometimes the families or individuals, they do not want to access the service in the community where they are. So what we do is we take the services to multiple locations within the community, within the city, so that families can access the service where they are. The other important part is also to take our childcare services where the clients are. And then assisting all the newcomers to navigate through the courts, the legal system, and providing that they cannot afford any of these costs of lawyers. So connecting them to resources like legal clinics and having that at our fingertips, all the services under one roof, that really is a very effective strategy. And the other innovative thing is providing that very culturally sensitive first language support. So providing that support, a counselor who speaks their language, who understands their culture, the nuances of their culture, the gender nuances. So that makes it so much easy for them to just open up and feel safe and build that trust right away with the counselors. And there are times when the counselors are not speaking their language. So we do have a huge pool of interpreters that they could be volunteer interpreters, and they're trained as well. One of the other unique feature is that we are able to engage perpetrators as well. That is truly innovative and forward thinking. And those are some of the very unique features that makes this program such a novel support that is available for the immigrant families in Calgary.
So one of the very unique and novel feature, I would say, is creating and developing the natural supporters in the community, which is very important because sometimes the clients may come to counseling session, may come to SIVA, may access those services, but at one point we want to empower them so that they can be independent and they can deal their issues by themselves. So we train the natural supporters, we do the support groups for them, we do the workshops and presentations and train them that how they can recognize the domestic violence, how it is important not only for them, for whole community, and how they can help the community members. So that is one of the unique features I would add.
SIVA has, in general, a very solid outcome measurement framework in place. And this includes our initial and ongoing needs assessment that really measures the client's the basic employment, language, social and emotional needs. Again, it's assessing the risk and protective factors, as well as the client outcome rating scale. So these are all completed at the end of each session. So that is the one part. And the second part is our client outcomes that, we talk about knowledge barriers, the rights in Canada, social networks, coping strategies, use of safety plans, gauging their level of confidence, connection to the community resources. So all of these things are actually measured through the CORS tool. We gauge the client satisfaction through, again, the CORS as well. What it includes is, was the client needs addressed? Did they receive the useful information? Were they finding it easy to navigate through the information or the resource that they were connected to? So these are all, again, measured constantly at the end of each session through that CORS tool. We have support group that when we do support group, we have the support group feedback forms. Again, they are also completed at the end of the support group and also same at the workshops as well. The program accessibility or the demand for the program is also measured through the number of clients accessing the services outside of SIVA. And this information gathered helps SIVA to see if the demand for this particular program is more in this neighborhood. So we should, constantly enhance to branch out in those other communities. In addition to that, we constantly gather the verbal feedback as well. Sometimes the clients who may have, challenges expressing or formulating or articulating that in a form or something are constantly giving that feedback. So those candid feedback are taken into very much due consideration here. So if I can give you a quick snapshot of some of the outcomes that we achieved during last year. For instance, one of the short-term outcomes is that the clients feel they are safe from abuse and violence. So our target benchmark is 80% of the total clients served report feeling safer. So our rating of evidence that we found out was quite more than what we expected. Similarly, if I can speak to one of the midterm outcome. So one of the midterm outcome is that the client access their community support services. So how do we gauge that? Again, all of our target benchmarks are set to 80%. That 80% of the client reports increased ability to access the community resources independently. Again, our rating of evidence was more than what we expected. We achieved more than what we expected. One of the other outcome, which typically is very vague to measure, like how do we measure that the client understands or they learn about healthy relationships and their rights, right? So again, our target benchmark is 80% of the clients report increased understanding of knowledge of masculinity, power, gender, and its relationship to domestic violence. In our rating of evidence that we achieved more than what we anticipated. The other tool that we use is the client outcome rating scale that helps both the counselor and the client understand or determine the level of understanding the issues being discussed during the counseling session and what needs to be discussed in the future session, right? So based on the 174 CORS or the client outcome rating scale completed, we found that 96% of our clients reported knowing what to do in an emergency. 95% of the clients reported being able to independently access the community resources. 87% of the clients report knowing about the family-related laws in Canada. The workshop evaluations that are conducted that enables the program staff to modify and customize the future workshops based on the needs identified. So based on 41 evaluations that this is just a sample size. Again, the evaluations are more, but based on the 41 evaluations, what we found is that 93.7% of the clients reported that they have learned ways to effectively deal with family problems that arise. Then there are 91% of the client that reported that they learned about the impact violence has on the family and the community, because multiple times our counselors use the lens of showing the violence through their children's eyes, because they may not see the impact of violence, but when counselors talk about how that impacts their children, it really hits them. 91% of the clients reported that they learned about the factors that increase the risk of violence in immigrant families. Then 81% of the clients reported that they learned about the programs and services available in the community to help victims. Then our support group evaluations, which are always helping the counselor identify the impact of the support group sessions on a client's life, and if any further follow-up is required. And support groups are not just one session. Just to add that these support groups are anywhere between 6 to 10 sessions, depending upon what the support group is about. So, and it could include multiple topics like, the anger management, stress management, impact of family violence, impact of violence on children. So based on the 45 evaluations that we collected, and this is again the sample size, so 93% of the clients reported that their safety and support network has improved because of the support group. Now that they have a bigger pool of people that they have similar issues, they feel more connected to, they can talk to them as well beyond the counselor. Then 98% of our clients in the support groups reported being more aware of services in the community, and they feel they would be comfortable accessing them independently. Again, 94.7% of the clients report being able to handle family conflict better now because of the knowledge, the skills, and the tools and strategies that they have gained now. It is not an easy thing to engage men and boys in violence prevention. We all know that, but we take pride in the fact that we have seen quite a bit of success in that, and our partners with the domestic conflict response team also recognizes that how even though with all language barriers, with the cultural barriers, we are able to still break that barrier because we use the same cultural lens we come from that perspective that, oh, we understand why you are in this situation, what perpetrated that behavior. So we are really providing that safe space to the perpetrators as well. There are the unique features or circumstances that might limit the transferability of the program. And in our experience, we have seen that there is a huge amount of digital device control that happens in where there is a lot of abuse happening, right? So for instance, I personally have come across a situation through this particular program when the counselor received an email, and it seemed like it is the client who's communicating, but it didn't take us too long to figure out that it was actually the perpetrator who was using client's email and digital device and everything to communicate to the counselor. So in some instances, we have had provided in the past also some cell phones that we can give it to the clients, so then they keep it safely, keep it away from the perpetrator. Sometimes also the shelter itself, it could be in a metropolitan area as well, but then there are shelters, there are agencies, there are staff and everything, but then the space in the shelter is not available. What do you do with those kind of situations, right? So for example, what at SIVA we did was we partnered with some of the hotels so that until the shelter becomes available, we are able to cover the funding for those families or individuals with children. They can be easily placed in the hotel with full safety, confidentiality, and all those measures in place, with police being aware. So, those things could be limiting in terms of transferability if those things are not available. We do have quite a few times that organizations have either been interested to learn from the program, and particularly specific components of the program, right? So for example, we have a similar immigrant serving women focused organization in Red Deer. It's called CAIVA, Central Alberta Immigrant Women's Association. So they found it very fitting to provide it from the cross-cultural parenting lens. So we have provided them the facilitators training as well, and they have our cross-cultural parenting manual that they have access to as well. SIVA has a strategic priority. One of the part of the strategic priority is taking the leadership role and offering that mentoring support. We are very much willing to share the logic model. We are very much willing to share the tools that we have. So if anyone would like to use this as a prototype, SIVA will be very happy to provide that.